today I'll be sharing with you about 7 diseases which I refer to as silent killers. And why I use that word is because many people walk on the streets with some of these diseases and they don't know. And many times they don't pay attention to it until it causes something severe, and at times they could result in sudden death. The 7 of these diseases include: number 1, hypertension; number 2, diabetes; number 3, obesity; number 4, angina; number 5, stroke, this non-severe form; number 6, kidney disease; and number 7, liver disease. So it's important you understand this disease so that you can prevent them to a large extent. So I'll start by talking about hypertension. This is the most common chronic disease worldwide, and in certain places you have 1 in 4 adults and at times 1 in 3 adults having this disease. Usually the underlying cause is not known, even though we know that it may be caused by kidney disease, may be caused by some endocrine disease, and it's also common in people that may be obese. As regards the symptoms of hypertension, is usually unreliable. However, the BP is usually above 140, and that's for the systolic, and the diastolic BP, that's the lower BP, is usually above 90. And hypertension, if left unchecked, can actually damage the heart, can damage the brain, can damage the eyes, and other parts of the body. How can you prevent this disease? First, it's important that you control your weight and also make sure you do adequate exercise. It's also important that you watch your diet, ensure that you take a low salt diet, which is also rich in fruits and vegetables, and also have low fat content. It's also important that if you're smoking, you quit smoking, and you also ensure that your alcohol intake is moderate, or if you can abstain from it, and that's quite okay. With this, you can reduce your chances of having hypertension. Diabetes actually results from high blood sugar, which could be as a result of absolute or relative insulin deficiency. And interestingly, the incidence of diabetes is increasing worldwide. And the challenge of diabetes is that it can cause some severe illnesses, which include blindness, can cause amputation, and even death. And that's why it's important we know about it and we prevent it to a large extent. The symptom of diabetes includes excessive tests, which will cause excessive desire to take water. It will also cause excessive desire to eat, which we call polyphagia, and usually there's usually associated weight loss in spite of a normal diet. It's important you understand how to prevent it. First is for you to make sure you do a checkup. You should know your blood sugar. Any blood sugar or fasting blood sugar more than 126 is actually diabetes, and we must make sure we check it. It's also important that we ensure that we watch our diet. We should take take a lot of fruits and vegetables, and reduce pure sugar, and take moderate carbohydrates. It's also important that you stop alcohol, because it also worsens diabetes. It's important that you also control your weight and also do exercises. That will help you to reduce your chances of having diabetes, or improve if you already have it. Obesity is increasing worldwide and is now even considered a pandemic. And this is unconnected to the change in lifestyle, which includes the kind of diets, Western nice diets, and also the Western lifestyle where there is becoming increasingly sedentary lifestyle. To know if you're obese, it's important you check your weight, usually your weight and your height, which is used to calculate your BMI. Any weight, the normal weight or normal BMI is supposed to be between 18.5 and 25. Between 25 and 30 is considered overweight, and once it's greater than 30, that's obese. And obesity has 3 levels. You have grade 1, which is when the BMI is between 30 to 35, grade 2 when it's between 35 to 40, and grade 3, which is severe obesity, when it's more than 40. It's very important that we prevent this by watching our weight, and we can control our weight by taking the right diets, which includes watching your fruits and vegetable intake, making sure it's increased, taking moderate carbohydrates, taking a lot of water. Some of these things will help you to improve it, and also ensuring that you do adequate exercises, and make sure that if you're obese, you see a health professional to take proper care of you. The next one is angina. I'm sure most of us would have heard about angina, angina pectoris, and things like that. As simple as this disease is, it's very, very, very important, and usually causes central chest pain that is relieved by rest and aggravated by activities. And what actually causes angina is when there is reduction in blood supply to the heart, which may be caused by obstruction in the vessels as a result of excess cholesterol or atherosclerosis. Okay, it's important that we understand the symptoms. So when we have chest pain that is recurrent, getting worse with activity and relieved by rest, it's important we think angina and we ensure that we take proper precautions as necessary. The same preventive technique is just similar to what you do for hypertension, diabetes, and obesity. You want to ensure that you take the right diet. You want to ensure that you rest, and also you consult a doctor for the proper medications if you are sick. Stroke, yes, most of us would have heard about stroke before in different ways. Probably someone had a sudden weakness of the right part of the body or sudden weakness of the face. Yes, that's actually as caused by stroke most of the time, and there are times that it results in death, and that's why it's important that we know about it, because if we know about it, then we can actually prevent it. What causes stroke? A lot of times it can be caused by things like hypertension, diabetes. The incidence actually increases in age, and we can try to prevent it as much as possible. And the way to prevent stroke is to make sure that if you have hypertension or diabetes or any of the risk factors, you make sure you treat them properly. If you're smoking, that's the time to stop smoking, and you can even stop so that your chance of having it is less. And also moderate alcohol intake, or if you can prevent it, that's even much better. Okay, and let's also make sure we do proper checkups at the hospital as much as necessary. So also important is chronic kidney disease. Most of us will have heard about patients requiring dialysis or a kidney transplant. And this is what happens when a person has this kind of disease. And usually it doesn't start in a day, it starts over time, and we must learn how to prevent it as much as possible. Diabetes and hypertension are one of the leading causes of chronic kidney disease, but it could also be caused by any other things like a severe urinary tract infection and things like that. What are the signs of chronic kidney disease? The patient could have an ascites, that's a swollen abdomen and swollen legs. Usually in the hospital, there are tests that could actually suggest it, like a renal function test that could show elevated urea and creatinine. The patient could have what we call a proteinuria, which is protein in the urine, and at times even blood in the urine. How can we prevent it? First is to avoid nephrotoxic medications. Let me better put it this way: avoid self-medications, because a lot of medications are toxic to the kidneys. It's also important that we treat diabetes and hypertension properly if we have it, so it doesn't damage our kidneys. Then finally, let's make sure we take a lot of water and ensure we treat urinary tract infection promptly. That's when you have urinary tract, so that also doesn't increase your risk of having kidney disease. So finally, I'll be talking about chronic liver disease. The liver is a very important functioning organ in the body, and it's important for detoxification, metabolism, and several other functions in the body. And a deranged liver actually is not good for the health. The common causes of liver disease are excessive alcohol intake, viral hepatitis, and certain drugs. Okay, the signs of liver disease could include things like jaundice, yellowness of the eyes. There could be bleeding tendencies. Then the person could actually have swollen abdomen and certain other signs. How do we prevent liver disease? First, avoid self-medication. Some of these drugs you pick over the counter are actually toxic to the liver. It's also important that you reduce alcohol intake, or make sure it's safe if you have to take it, and also make sure you do check up for viral illnesses like hepatitis B and hepatitis C. This can also help you to control liver disease to a large extent. So that's all for the 7 deadly silent killer disease. I want to encourage you to go and study more about it, ask questions, and make sure you arrest this disease before they arrest you. So my big advice: stay healthy.